Labels are good, right? Or are they? Sometimes we have to have labels, and sometimes they're not such a good thing. So let's kind of investigate that, because I think that we need to be very careful about how we label ourselves. Before we get into it, please hit like and subscribe and share this with anyone you think might be helpful to. And let's get into it. So yeah, labels are really important. If I'm putting away all of my Christmas decorations or whatever season it's in, I want to label the box so I know where they are next year when I want to pull them out of the attic or the shed or wherever they are stowed away. If I'm buying food products, especially things that are perishable, they have an expiration date on them. I want to know how long I can keep them in my cabinet before I need to toss them or use them. I need a label to know what the ingredients are. I need labels to be able to make informed decisions about how I'm going to govern my life. But sometimes labels aren't so good when we're talking about people. Now, it's important to understand that doctors need to have diagnoses, and they will label people with certain illnesses. And unfortunately, we often have a habit of saying that cancer patient. When you see your doctor, he's going to check you out and he is going to give a diagnosis, a label of sorts, that is going to identify what your particular illness is. That illness will help or inform the doctor on how to treat your illness and how to help you as a patient. And for that reason, those labels, those diagnostic labels, can be really helpful. We use them all the time in psychology. We use them for our clients or our patients, depending on your frame of reference. But we use those labels for the diagnostic, that for people who meet diagnostic criteria for certain mental illness or disorders. Those labels are really important if the provider wants to get reimbursed by an insurance company. Those labels help us know how to treat, how long we can expect the treatment to last, what we can expect the outcomes will be. It will help us, inform us on how to be most helpful for our clients. The problem that we have often, though, is that when we start seeing the label as the patient, and the patient starts identifying themselves as that label. So I will often hear people say things like that they have bipolar disorder, or they have a personality disorder of sorts, or they have PTSD, or they have anxiety. And that may very well be true. I'm not saying that that they don't meet the diagnostic criteria for those diagnoses. What I'm saying is, when the patient or the client starts seeing themselves as that, they put themselves into a box. They paint themselves into a corner that they don't know how to get out of. For example, I have clients who say, I have anxiety. I've always had anxiety. I will always have anxiety. And they believe that they have no power, no agency in their own life. So when they have that belief, they really are boxed in. When a provider such as myself looks at someone through that lens, that's all they see. Oh, okay, you came in with this diagnosis. I'm going to treat you for this diagnosis. You've checked all the boxes for this diagnosis, and therefore I'm going to treat you as if you are this. And I don't think beyond that. We start looking at people as if they are not capable of doing anything else. Oh, anxiety, we think of it as, perhaps something that's genetic, something that is just kind of built into that person's system, and we don't think of how they can change their lives. I talk about change all the time, and I believe people, every one of us, is capable of change. Maybe not to the extent that they want, or maybe that they can at this point in time, but I believe that we are capable of changing. That we all have strengths that we have to recognize and utilize so that we are not trapped in a diagnosis. I'm not saying that someone with post-traumatic stress disorder has the ability to never have a trigger again, to never have a relapse, never have a moment where they are in a moment of panic, that someone with anxiety disorder is never going to have a panic attack. I am not suggesting that. But what I am suggesting is that we can train ourselves to think differently and respond differently, and that those symptoms will decrease over time if we believe that we have the strength and the capability to do that. But if we take the label that is given us and we walk around saying, this is who I am, I'm never going to be any different, then you're not. I try not to use my own children too often in these talks, but I will go here for just a moment. My youngest daughter was diagnosed with ADHD when she was young. I could go into that, and that's another hour on something else. So I'm not going to stay there. But she was diagnosed with ADHD when she was very, very young. And she was on medication for a short period of time. But she hated the way the medication made her feel. And so she said she didn't want to take it anymore. And I said, that's okay with me. But you have to understand that medication or no medication, you are still responsible for your behavior. And you have to learn the coping skills to be able to work through this. And so she did. And she has been able to do that in her life, finding things that will help her. I resist the temptation to say, oh, well, I have ADHD, therefore I don't have to be responsible for my behavior. I don't have to be responsible for forgetting things or for not getting my work done. No, you are still responsible. You have to just figure out how to make it work for you. And I think your therapist will help you do that. Medication may be necessary for some people, but by and large, it's probably not. And it's probably one of the most overused diagnoses, and the medications for those are some of the most prescribed medications that are out there. I don't think you could throw a rock very far without hitting someone, or at least several someones, with ADHD or who have a diagnosis of ADHD. And that becomes their excuse. Oh, well, I have ADHD. I can't pay attention. No. Some of the most successful people I've ever met are people with ADHD. And that kind of goes into the whole subject of people who are neurodivergent. That's one of the wonderful buzzwords of the day, that people are neurodivergent. And I know that there is a definition for that. But the reality is I think most people, if you really scratch the surface very deeply, will fall into that diagnosis or could be labeled as neurodivergent because they think differently than other people. They have a different way of processing, of learning, of applying the things that they have learned. And again, the labels can be helpful to professionals who are helping you work through something. But a label, when it is used as a shield, as a diversion, as a tactic to throw off any responsibility, personal responsibility for behavior, then I think that's a problem. We have to let go of those labels. In child development, we often talk about using the child first language rather than the label first. You know, when you'll hear teachers say that ADHD kid or that neurodivergent kid, or that physicians may refer to that cancer patient, that heart patient. They start thinking of the person in terms of the diagnosis rather than the person and their own personal strengths and how they can fight through or overcome whatever difficulties they're dealing with. So what's my final word? Well, it won't be the final word, but my final word for today on this: don't wear a label as if it defines who you are. You are much more than a diagnosis. You are a beautiful human being who has your own thoughts, your own feelings, your ideas, your beliefs. You have strengths and you have resources. And I want you to figure out what those are. Identify those. Label those. Okay? All right, guys. Please hit like and subscribe, and I'll see you next time.